Okay, hi everybody, and welcome to another episode of the Serdentity podcast. I'm your host, Elizabeth Dewar Anthony, and my guest today is my good friend and fellow professional, Dr. Jeff Goldberg. He's in Buffalo, and I'm in Rochester. You specialize in TMJ dysfunction and maxillofacial pain issues, and also sleep apnea. And also, Jeff's mother is like the longest practicing hygienist in Rochester history. Flo Goldberg, she practiced at Dr. Rosen's office before I even thought about going to dental hygiene school in 1985. So she's an inspiration to all of us.
Thank you very much, Elizabeth. Thank you for having me on the podcast, and thank you to these wonderful listeners who are tuning in to learn. Do my best I can to shed some light. Just for clarification, the specialty is called orofacial pain, and it's the newest specialty. Sure, it's the newest specialty in dentistry. So we now have 12 board recognized official specialties under the American Dental Association umbrella. The newest one being in the really darkest days of COVID, which was very end of March, beginning of April 2020, when everyone's offices were shut down, that the ADA announced the acceptance of orofacial pain as the 12th specialty. So it was really kind of a unique set of circumstances. It's been 30 years in the making, of course, and for those of us that were practicing as specialists and had done the education and so on, many like myself, I'm sure, were closed. The offices were closed. We were all wondering what was happening to dentistry at that time. It was being called out as an area of concern with COVID. We had no idea what we were dealing with.
Oh, yes.
And, it really was a perfect time to kind of reflect and pivot and think, when this breaks, whatever that might be, how are we going to come back, and how's my career going to be? And so we really were kind of privileged in a sense that it happened in that context and gave us the chance to come back from COVID as something a little different. Although my practice was basically a specialty practice already, now had that new designation. So all in all, there's probably 250 board certified orofacial pain specialists in the United States, and that's including a number that are retired and a number that are teaching or doing research. So
that's not very many.
That's not very many. Somebody told me there's about 50 practices, as best they could estimate, that are strictly limited to orofacial pain. And I'm putting dental sleep medicine sort of under the orofacial pain umbrella in this case, because it often is a big part of our practices. Absolutely. But yeah, effectively, there may only really be like 50 or so practices in the country that are like mine, that are kind of exclusively orofacial pain.
So that makes sense, because most of the oral dysfunction that creates sleep apnea also contributes to orofacial pain, and sometimes people have the pain is what drives them to seek treatment, whereas they've had sleep apnea for a long time and they just figured, well, I'm just tired. I'm tired because I'm old, or because, whatever, the baby's keeping me up. And people they don't put the dots together. And another thing I was thinking while you were talking was, during COVID, they had us with like nail salons and hair salons in terms of like our categorization, which just, I'm like, really? Which just goes to show, the generalized kind of ignorance of what the dental profession is. There's still that public lack of knowledge and understanding about, the oral cavity and how important it is.
Well, I think to some degree, it was just sort of the ease of it, and sort of the logic of saying, well, dentists, you're really hanging right over people's mouths. And you remember, of course, at that time, we really had no idea what we were dealing with COVID. And, so we have to kind of remember that mindset. And it is true that in regular dentistry, general dentistry, there's aerosols and things being, sprayed. And it's just one of those easy things for people in media to kind of pick on and say, this is seems like a dangerous place for an airborne virus pandemic that's raging. But at least in my specialty, it immediately occurred to me 6 feet away. Everything I do is 6 feet away. Most of, and many of your listeners, are practicing dentistry and practicing medicine over telehealth and
Yes.
from miles away. So this notion of having to be 6 feet away was not a big deterrent in my practice. I didn't really love the dentistry of hanging over people's mouths and drilling and filling on their teeth. That's why I got out of it. It was not a career path for me long term, and thankfully I found my career path elsewhere. But from a COVID standpoint, it worked out well.
So Serdentity is a combination of serenity and dentistry. And it's a philosophy that I created that I'm seeking to improve people's experiences in the dental setting, both patients and professionals. And so the serenity comes from an increase in empathy, which comes from greater understanding. So I've been talking about dental fear for over 20 years, but I didn't realize till I became an orofacial myofunctional therapist that it's the airway. I knew patients were fearful and they could present very, with a lot of real defensive behaviors, but I didn't put those pieces together until I started to learn more about the airway. And it's kind of unfortunate that, I had been practicing for many years. At that point, I'd been practicing for 30 years, never, putting the two things together. That, it's that trauma comes from not being able to breathe. And people are going to get that breath no matter what. And the brain is going to breathe no matter what. And the brain doesn't care what I need to do in your mouth, right? The brain's just going to be like, nope.
Well, let me, if I may, expand on that a little bit.
Absolutely.
You're talking about something that I have given a lot of thought to and like to expound with other dentists on exactly that kind of thing. The jaw, the oral cavity, when we think about it at its most basic, level, any animal, in order to survive, needs to be able to do two main things, above all else: breathe and eat. And in our case, and in most animals, the mouth, the jaw is absolutely essential for both of those things.
Yes.
In fact, animals other than human beings, wild animals, cannot survive without their teeth. They cannot survive without a functioning jaw. They cannot survive without an open airway. And humans can only survive under those circumstances, with innovation or technology. So this speaks to a very, very deeply rooted concept of ourselves and our survival. When I deal with patients who are sort of what seems to be like an exaggerated sense of stress or anxiety about their jaw condition, it helps to realize just how this affects people. Unlike probably a lot of other parts of the body, when the jaw doesn't seem to work right, even if it's just just something small like it's clicking or it's there's some relatively mild pain, the effect on that to somebody who has that deeply rooted sense that, oh no, if my jaw doesn't work, I can't eat and breathe, going all the way back to their most animal sensibilities is necessarily, pushing some real high alert buttons. We add to that then the next level, which is to go from the animal to the human, and as humans, one of our most critical functions is to communicate, to speak and to make facial expressions. And for all of that, again, nothing more central to that, nothing more important than the jaw and the mouth as the vehicle for that. So now we've got eating, breathing, and communicating,
Yeah.
expressing ourselves. It's right in the middle of the face. Of course, your identity, your um, the way that people recognize you and know who you are and what you're up to, and of course, it's surrounded by every other of your most critical senses: your eyes and your ears and your nose, and your brain is not far away. So
Right.
the mouth occupies such a central part of our psychology and such a central part of our physical body that absolutely, when things are not right with this, it is a high alert situation. It does occupy a greater part of our mind than it maybe sometimes seems like it should, given the uh, if we kind of think of it in purely, well, how bad is the pain really, or how much really is something anatomically disturbed. It takes on this sort of magnified importance, and we have to be prepared for that. We do have to understand where our patients are coming from when they feel that something is not right.
So two things. Um, I absolutely agree. Well, three things. I absolutely agree with everything you just said, and I love it. Um, one thing I say to my patients a lot is you don't realize how much you use something until it hurts.
Yeah.
So when the TMJ is inflamed and it's affected, you don't realize every time you swallow, you go to eat something, and sometimes even with speaking, um, it can be painful. And somebody that's not having that level of pain, not having that experience, can't, they just don't understand. Well, what's your problem? And
Mhm.
also the high alert state in the brain, you know, that's exactly what trauma, when patients have been traumatized, and they come into our office and they're on high alert. Their primitive brain is over functioning because they've been traumatized, and they are expecting to be re-traumatized, and therefore they have a lot of defenses.
Yeah, I certainly, you and I both, and many of your listeners, see patients that have degrees of trauma that they would classify as trauma, and they'll speak to that or recognize the place that has in their life, and we certainly are uh, sensitive to that, and it affects how we're going to approach the problems that they have. Uh, I think there's a version of trauma that's worth mentioning that many patients may feel, they don't have trauma. Why are we talking about that? I didn't come here to,
Right.
come out, try to dig up some thing that happened in the past or what have you. I'm here because I have a very straightforward medical condition. When we talk about the sleep apnea a little bit, sleep apnea is classified by the breathing being disrupted, and more specifically because the airway has collapsed or closed in a way that a person can't draw air. That is a very triggering, or we can use the word traumatic experience, in that it triggers the fight or flight response, the
Mm-hmm.
sympathetic reaction. So when a person is moderate sleep apnea, they come to my practice or yours telling us they have an AHI of 20, they stop breathing 20 times an hour. That's a moderate sleep apnea. We understand that's not severe. That's very typical of a patient that we would see. But 20 times an hour means that 20 times does their airway fall closed for at least 10 seconds, and they cannot bring air, or at least not sufficient air, into their body. Their body flips from, of course, one extreme, which is being asleep, being at
Mm-hmm.
rest, parasympathetic, immediately and sharply the other direction to this crisis mode, ready for action,
Mm-hmm.
battle ready kind of aspect. And so that's a harsh turn. That's a harsh turn.
Mm-hmm.
And of course the body does what it needs to do, gets them breathing again, opens up the airway, and settles back down to sleep. And about 3 minutes later, the same thing happens again, because
Right.
even 20 times an hour, we're talking once every 3 minutes. And if you could imagine trying to do anything, and every 3 minutes, and I imagine every, one of your listeners has had this experience in some form, where it's like, oh my God, every 3 minutes, the phone
Mm-hmm.
rings. Every 3 minutes, another knock on the door, another crisis that needs to be dealt with. You can relate to that experience. Now, imagine that 6 hours, 8 hours long, all night long. That's what your body is dealing with, and how taxing that is, not only on your sleep and fatigue related to that, but the just the general health. I mean, what an unhealthy thing that every 3 minutes your body
Yes.
has to flip flop from one extreme to the other. So trauma indeed is a good term for it. That we talk about PTSD and things in relation to trauma. It has a lot to do with that sympathetic overtone, that high
Yeah.
alert status that people will sometimes find themselves in a disproportionate degree to their actual real safety. Is a deeply psychological phenomenon, and unfortunately, with sleep apnea, their body is coming in and out of that phase a lot. And again, we could say similar things about pain and specifically jaw facial pain that triggers a similar sense of urgency and a similar sense of alert that is triggering some of those same sympathetic reactionary responses.
That is amazing. And I thank you for that explanation. I have never heard it put quite like that, but it absolutely, you just nailed it.
Well,
Um,
thank you.
wow. Um,
Have I left you speechless? Is this the first time?
believe me, that to render me speechless is quite a feat. But so what I was thinking was, so all night long, you're trying to rest and digest, but your brain, you just keep going into that sympathetic. So yeah,
Right.
and that gets interpreted neurologically. And
Yeah.
some people, they have nightmares, right?
Mhm.
Because it's really because they can't breathe, but they're dreaming that they're being strangled, or they're something bad is happening. But what it really is their airways collapsed, and their brain, that the front brain, is trying to attach some sort of meaning to it.
Hmm.
But so I was thinking too, by the time patients get to you, they've been
Yeah.
suffering. And I would imagine that you have had, more than your fair share of experiences with people who were in a pretty high state of fight or flight when they got to you. And, you know, first things first, you got to bring that down, right?
Yes, but I'm not going to quite give 100% to that. And here's where I'm coming from in that response. I think the field of treating TMJ disorders and orofacial pain uh, has a reputation in dentistry of being a field where we deal with very difficult patients,
Mm-hmm.
patients who
Yep.
who've really suffered a lot, who have a lot of emotional baggage, and that's a real turnoff to a lot of dentists, because a lot of dentists, they like the sort of mechanics of dentistry. They like to be able to solve problems and solve them in a
Mm-hmm.
definitive way. When you pull a wisdom tooth, the tooth is gone.
Right.
That's it.
Yep. That's it.
Rarely is there much gray area about that. But the notion of treating pain and is a much murkier, much more nuanced kind of thing. And it's even, I remember early already having made the decision to go into this, spending some time with a really top orofacial pain provider in New York City, and talking to his patients and being told, oh, you've been a patient here for 20 years, 25 years, and they're still in pain, and they still have imperfect
Oh,
situations, and they're saying, that yes, but we know that this is the condition. It doesn't get fixed 100%. You know, it comes and goes at different stages. I would never want to be without the treatment I'm receiving. There's wonderful value in it. But I'm not expecting 100%. I would be a 9 out of 10, and instead I'm a 3 out of 10, and
Mhm,
that's a good outcome. So, and a lot of dentists would have a hard time with that. So,
mhm.
I want to, uh, give a little more of a realistic picture of a practice like mine, but also at the same time counteract, what I think is a lot of the belief out there that these patients are by and large very, I hate to use the word, but very, very damaged, very,
Yeah,
very,
no, I get exactly what you're saying.
most of my patients, it's wonderful when I have dental students come here, and we do quite often, and they're like, wow, I expected to see all these, tears in the waiting room, and people that are barely hanging on. And mostly we're just being very, very normal, very comfortable, well-adjusted people who
Okay,
have pain and headaches and airway issues. But for the most part, they are wonderful and appreciative and realistic and in control. Do we get cases where people have been through 27 surgeries
mhm,
and
mhm.
have traveled around the country and beyond trying to get the right kind of treatment and have been misdiagnosed, misled, mishandled in one way or another, and have just had strange and unfortunate and bizarre experiences? Yes, we do see all of that,
Yeah,
but I wouldn't consider it the majority. And for the most part, the patients are really, it's a wonderful and very sane area of dentistry to be in. So I don't want anyone who's kind of maybe in any way turned off by the stereotyping, to misunderstand what it's like in the day-to-day practice.
I appreciate that, and obviously I was thinking along stereotypical lines, so thank you for calling me out on that. And so you feel like no more than a general dental practice do you have a percentage of people who you would call in a high fight or flight sort of state. I've
That's
worked.
probably true. Yeah. Maybe a little bit more so, and maybe we dig for it a little bit deeper in the sense that people that are going to the dentist to get their teeth cleaned, and that
Mhm.
that interaction may be a little faster and a little or maybe a lot faster, and not delving into getting to that kind of discussion about chronic pain.
Oh,
And
it can be pretty. Coming in for a cleaning can be extremely triggering for
yeah,
people who've they've had the experience of feeling pain and shame in the dental office. So they
mm,
come in expecting to have more of that. And
okay,
so the cleaning, uh, one thing I'm trying to get away from in terms of
yeah,
talking about what it is that dental hygienists do and that we do in the dental office is, can we get away from clean and dirty? Okay, it's not about clean and dirty. It's about your microbiome. It's about the bacteria that are populating, and your mouth is the first stop in your whole digestive tract. So it's not separate. And I don't know why dental hygienists seem to have such a great talent for shame and pain, but it's not about flossing more. It's about learning how to balance the microbiome in the mouth, and it's none of it is a moral failing. This is the one of the biggest things that I want to get across, is that even though we don't mean to, okay, we create shame in our patients when we act, when we lecture, when we you need to floss your teeth, and they interpret it, whether or not my intentions are, they interpret it as an attack on them, I'm some sort of moral failing. I'm a bad dental patient.
yeah. I'm sure that yourself being trained and although no longer practicing dental hygiene, a longtime hygienist. Your amount of time and your experience with the dental patient is different from that of the dentist. And if I'm speaking to a group of dentists, they're probably more likely to confirm what I said, which is, it's a fairly brief, casual interaction with a lot of those patients, where the hygienist, as they, can find themselves in some fairly deep conversation in the course of a cleaning exam or a cleaning appointment. So yeah, I'm sure that it's there, and it's there just under the surface for those that are willing to break through and ask the questions and find it. I think a lot of times when it's not what you're looking for, people don't want to find it. You don't want to know that this patient's got a chronic pain issue that isn't what they came in for today.
Right.
But yeah, I would kind of going back to where we were talking about, say that one of the great things, and it's just such a shame that more people don't know about this specialty, and more people don't take an interest in the specialty among our young dentists, because they don't know what it's really like, and how enjoyable it is, how rewarding it is, to just kind of sit back sometimes and let the patient say what they need to say, recognize the patterns, understand the pain that they have, and kind of know that, okay, I have a solution for this. I know that this is a TMJ disorder, this is trigeminal neuralgia, this is burning mouth syndrome, and when they're done saying their piece, I'm going to be able to offer a solution that, again, may not be a fix, but it may be a very significant management tool that's going to change their life, and be able to get that into their hands, and dress it up nice and have fun with it. And I'm fortunate, to work with a wonderful team here, and we all kind of come together and enjoy the process of delivering something wonderful into patients' hands, as all of your listeners do in their various capacity in the medical and dental field here. To have that power, to have that tool, and be able to present that to people and give them some hope where they didn't have hope, whether it's a big part of their life or a relatively smaller part of their life. Either way, it's an area where they may not have had much hope, and you've given them hope. It's a wonderful thing. And my practice, I think, like many in the orofacial pain field, even as few as there are, is a real kind of boutique feel. You talked about that serenity that influenced your the name of your business, and your podcast, and your
My
sort of
philosophy.
your philosophy has sort of been the driving philosophy behind it all. Uh, I use that term and similar ones a lot in describing my practice. It's a real boutique environment, and it's quiet and pleasant, and we're able to give people that time and space, and that kind of luxury that they're looking for.
Yeah.
That is not typical in medicine. That's not necessarily a model that's going to work, and on a large scale. It some of that has to do with insurance and the sort of the market that you're serving, but at least for us and our patients, it is a nice way to practice, a nice way to make a living as a dentist.
That is awesome. So that's really our bottom line is, treating oral facial pain is rewarding. It's not, it's not frustrating. It's not demanding. You are definitely enjoying what you're doing. And I'm on, these a number of Facebook groups for dental people, and I don't hear a lot of that. So that's wonderful. I hear a lot of frustration. A lot of people are, they don't feel appreciated. They feel overworked. And I'm kind of trying to help them a little bit too, because nobody who wants to work at a job where you're continually frustrated. I don't, and what I found was when I have changed my approach to my patients, it was a better experience for everybody, not just for them, but for me too. And over time, I found that, patients that were labeled as impossible or very difficult in practices, I came in on a day temping and had a beautiful experience with these people. And
Mhm.
the front desk is like, what did you do? I'm like, I don't know. I just I just treated them like I treat everybody. And so, it could be, I don't know if I am self-centered and a narcissist, but there's got to be, statistically, there's got to be some sort of correlation there.
But it sounds like you're talking about expectations, and whether it's the expectation that a patient who has been given a label is difficult, and so whomever is made aware of that has that expectation going in,
Mm-hmm.
or you expect patients who have TMJ disorders or sleep apnea or whatever to be unhealthy or difficult or whiny or complainy or whatever. Once you attach the label, then that's why it's called an expectation. You expect that thing to happen, and if you can avoid that, then that would be great. So part of it is changing that expectation, understanding enough about pain to know that chronic pain is a very influencing thing. It
Mm-hmm.
changes the way people interact with the world. It changes their experience, and these are not crazy, whiny, difficult people. These are people who are living with a real challenge, who are literally in pain, who have furthermore, in many cases, had a very hard time getting that pain managed, and have, in some cases, been through an awful lot trying to get it managed.
Mm-hmm.
And it is frustrating, and you would be too if you were in their shoes, and I'm sure some of your
Absolutely.
listeners have been in those shoes. That being said, we one of the things that I point to a lot in my practice, a lot of my practice is based on making orthotics, or we call them
Mm-hmm.
mouth night guards. Um, Orthotics is really the most appropriate term, and we make all different kinds, and it's really a centerpiece of what I do. I love it. It's something that other dentists do to only a limited degree. We do it to, with all different types and materials and ways of using it and so on. So it's really become, sort of my expertise, so to speak.
Mm.
No other medical doctors do this. I'm in a building here in Buffalo that's full of
Yeah,
neurologists,
yeah.
brilliant neurologists. No, none of them makes a mouth guard that, they all give injections, they can all prescribe medication. They're not going to make a mouth guard. And so this is my niche. Now that's my definition of orofacial pain. Other people may very much disagree. Many people in orofacial pain don't make orthotics at all. But to me, it's a central piece. So we make these orthotics, and they cost a lot of money. Okay, and we understand it costs a lot of money. So we deliver them, and sometimes something happens. It either
Mm.
breaks, or
Mm-hmm.
there's a problem with it. And the patients come back and they say, "Oh, Dr. Goldberg, I broke the appliance. I must have clenched too hard, or whatever happened. I'm so sorry. Can I come in? When's convenient for you? When can I come in and get it, remade? And what's that going to cost?" And so now, if I paid that much money, honestly, as people pay for these orthotics, for a new oven or something in my house, a
Right.
refrigerator, and it broke, I would be a lot less polite than that
That's
on
right.
the
I'd
on
be
the phone.
like, excuse me?
Right. So, I mean, sometimes they come in from the lab and it's just not made properly, or it doesn't get there in time, and yet the patients are always apologizing to me,
Wow.
and after having spent that kind of money on something, uh, it just seems strange, and it's a wonderful thing. I'm very blessed to
Yes.
have that. It certainly beats the alternative. But you wonder, like, why are these patients so appreciative that they would actually apologize for uh, something when they've have a reason to expect something much much greater? And I guess we can come back to that word expectation. these are people that are in pain, and you are trying to help them, and
Mm-hmm.
not much of anyone else has been able to help them.
Mm-hmm.
Many times they may have heard that there is no help,
Mm-hmm.
and they, even if what you're doing doesn't work, you have the, really the obligation to communicate, and not the obligation to them, the obligation to yourself, to communicate. I'm going to try, and I'm going to do
Mm-hmm.
the best, and I'm going to do my, I'm committed to the science, I'm committed to the education. I'm going to do my best to take what information there is in the world, to read the books, to read the articles, to go to the lectures, to listen to the podcast, and I'm going to try to take whatever's out there and bring it to your case as appropriate, and help you if I possibly can. And it may or may not work. We may have to go through a bit of a process. It may not work right away. We may, have to try a few things. Um, but I am here for you. And that is everything. And if you
Mm-hmm.
can communicate that, and you can set those expectations appropriately, then I think that's going to be your experience, that these patients, whether you are able to help them or not, at least are going to be on your side. And that is a much nicer way to go to work every day,
Mm-hmm.
than it is to go in, ready for battle,
Yes.
uh, ready to fight with patients who are disappointed, upset.
Mm-hmm.
Uh, I can't believe I spent this much money and your thing didn't work and I still get headaches. So, you know, for your own sanity, for your own well-being, set the expectations properly. Uh, be upfront, be honest, be real, and you will have a wonderful experience just trying to help people.
So you pretty much just laid out Serdentity. Okay. It's
You're
the
welcome.
expectation. It's that you're setting the expectation. It's about approaching patients with non-judgment. And so I'm not expecting coming at this patient expecting a fight. I'm coming at them with as little judgment as possible. And that gives, the interaction an opportunity to go well. And it's okay for you to say, my patients love me because I'm awesome. All right. It's okay. It's all right for you to say that. I think they probably do love you. And just in our brief conversation, you really, really care about these people. And you can't teach that. You cannot teach it. You can't teach somebody to care about people if they don't care about people. I don't think. What do you think?
Well, I don't know. I think everybody's got the capacity to be better. And if let's say this, if they don't care enough about people, there's probably some opportunity to connect with it, whether it's going to be that somebody in their family unfortunately has a chronic pain experience, or they themselves. But something's going to bring to light, this in a more
Mhm.
meaningful way for them personally, or maybe they just haven't had a good experience with a patient who really appreciates them.
Mhm.
So, it's a matter of working on the communication skills, learning, and like I said, even if you do it from the most selfish place, you simply say to yourself, you know what, I want to uh, be really good at my job because
Mhm.
I don't want to face the consequences of not being good at my job. I don't
Right.
want to pay the price of having to deal with anger and people wanting their money back, and lawsuits and this and that. So it is in my best interest to at least pretend to care. And I think if you pretend long enough,
Right.
you're going to start to see, wait a second, there's something to this,
Right.
and it makes sense. So I don't think you can hide from it. And when you start to get the positive feedback, and you start to see the nice reviews that people may put online or to say about you, or the staff, I call team, not staff, comes back to you with some very kind things that patients have said, and you try to kind of listen in from the doorway or whatever, uh, and you get that positive reaction, then you start to appreciate the good that you're doing, and that hopefully motivates you onward. I had a wonderful gentleman, a dentist who I interviewed with when I was first starting out in my career. He said, think of money like sawdust. If your job is to make fine furniture, just focus on making the nicest, most fabulous furniture you can make. The sawdust will pile up. Don't worry about it. It'll be there. When you look down, you'll have sawdust. If you focus on making as much sawdust as possible, your furniture is going to suck.
Yeah.
It's going to be, you're going to grind away at the wood till there's practically nothing left. And as soon as somebody sits in the chair, it's going to fall out from under them, and your sawdust is going to land all over them. So don't focus on the sawdust. It'll be there. Focus on making nice furniture, and forget about it. I shouldn't say forget about it. You do have to pay attention to your economy and your business. I that's a whole nother podcast, but
right, it is.
But suffice it to say, focus on the quality of your work, and the other will more or less take care of itself.
I completely agree. And so we've been talking for over a half hour now. And
very good.
There is another podcast I want to do with you. When you mentioned burning mouth, I would love to speak with you about that and learn more about that, because that is creating a lot of suffering. And a lot of patients come to orofacial myofunctional therapy suffering with that. And, there's not a lot of knowledge about it. So we'll have to do another podcast.
All right. I would welcome the opportunity. Thank you.
So thank you very much for being on with me today. And I'm going to have to take a road trip, I think, up to Buffalo and just spend the day in your office.
We've had many visitors from all over. Had 2 students here today observing, and that's not uncommon. Anytime, of course, Elizabeth, come over here and we'll put up a little lunch and learn, and try to educate some people, some of the neighboring dentists as well. It's be great.
That sounds great. All right. So I'll look forward to seeing you again soon.
All right. Thank you.
You're welcome. Thank you.